There are three common questions that I get asked as an orthopedic surgeon. What shoes should I wear? What mattress should I buy? And should I use a brace for my knee pain? And although I don't have answers for the first two, I'm going to do my best to answer the third question, so stick around. Hello and welcome back. If you could take a moment right now, if you haven't already subscribed, click the subscribe button. And if you enjoy this content, click that thumbs up like button. It really helps the channel. And in today's video, I am going to talk all about braces. Now, in the office, frequently, I will see a patient and they will come in with a shopping bag and they will start pulling out braces. They'll pull out a brace with a hole in it. They'll pull out a brace without a hole in it. They'll pull out a brace with copper, one with magnets, one with hinges. Even some patients may have an offloader brace that they were either prescribed or bought online. And these braces can range in price anywhere from under $10 to over $800. And the question that a lot of people have is, do they need to wear a brace? Will the brace help them? And what the data shows is maybe. This one study looked particularly at soft braces, and what they did conclude was that this may improve pain and function in the patients that wear these braces. And when it comes to guidelines for treating all types of arthritis, the American Academy of Orthopedic Surgery comes out with guidelines every 3 years approximately. And their guideline when it comes to braces is moderate. And that was a downgrade from the previous guidelines that came out 3 years prior. Now, the American College of Rheumatology also has guidelines for knee arthritis, and they do strongly recommend braces for patients that suffer from knee arthritis. And all of this information is out there, but the big question comes down to, will it help you? And this is what I explained to my patients, is that number one, if you do not wear a brace, it will not make your knee arthritis get worse. So some people have been told by friends or family members that they have to wear a brace, and the brace hurts them or causes problems like swelling. And they're afraid to not wear the brace because they think their arthritis is going to get worse. So if you do not find braces helpful, you do not need to wear them. The other thing that I tell my patients is usually start with the smallest, least complicated braces. Usually the slip-on knee sleeves are the ones that tend to help most patients, in my experience, the best. When you start getting in straps and hinges, they can twist, can throw off the way that the knee bends, might cause pain. Sometimes they cut through the material and they can actually cut your skin. And the simple slip-on knee sleeves are basically unidirectional. You just have to pull it up and it doesn't have to be rotated in any particular direction. And my experience has been that most patients that come in and tell me that the brace does help them are usually using those types of braces. And what might it help? Well, for some patients, if they're chronic swellers, the compression of the brace can reduce swelling. For some people that complain of stiffness, especially when it's cold, the brace can offer some warmth to the knee. For some patients, what they get is a sense of support. They get this feeling of proprioception, meaning where their knee is in space. It's similar to the idea of KT tape or rock tape when the therapist put that on your skin. It just makes your brain more aware of where your knee is in space when you're bending and pivoting. And for a lot of patients, what I discuss with them is you don't have to wear it all the time. If you play pickleball, you might wear it when you play pickleball. If you enjoy hiking or even just walking after dinner, and that's when your knee bothers you the most, you put the knee brace on for that particular activity, and then you take it off for the other activities when you don't need it, or it's not as important. Now, the one little tip and caveat that I will leave you with, though, is if you're going to have a knee replacement, and if you're reliant on a knee brace, I tell my patients to not wear the knee brace for 2 weeks prior to surgery. Why? Sometimes, if it's hot outside, the knee brace can make the skin warm, it can cause a heat rash, and we don't want to operate through a rash, so your surgery could be canceled. Also, many of you may be instructed to use a chlorhexidine wash before surgery, and that can irritate the skin. And I'm not sure whether or not it's a combination of the brace with the wash that causes some of this, but many years ago, I started to see patients that would wear braces leading up to the day of surgery and come in with these rashes. So I made it a habit of telling patients that do not wear any braces on your knee. Let the skin breathe for the 2 weeks prior to surgery. So I hope in this short video I've answered some of the questions that you may have had about braces. Which ones should you try? Do you need to use them? And if you don't use them, will your knee get worse? If you haven't already, check out the rest of my channel. There are lots of videos all about knee replacement, the before, during, and after. And as always, until next time, stay safe.